in her time of need.
I was afraid that I was going to actually have a stroke.
Katie Vigilante was numb on her left side and scared when she was at an emergency room in Charleston last spring.
I felt completely helpless.
And help was not coming anytime soon.
I actually was there over 6 hours waiting.
But the longest wait of Katie's life is just a part
We have an auto accident on the Shillian Bridge.
of what EMTs say is an ongoing problem. Long wait times for all patients at Kanawha County E.R s.
They're in pain much longer than they should be, and in some cases have probably died from the lack of EMS care because of the hospital wait time.
Where's your emergency?
As the director of Lincoln County Emergency Services and a paramedic in the city of Charleston, Alan Holder says long ER wait times happen every day.
We have a tremendous problem in the Charleston, Kanawha County area.
WSAZ gathered Kanawha County Emergency Ambulance Authority data from 2015 showing that even patients transported by ambulance are waiting, some as long as 4 hours, from the time ambulances pull into the emergency bay to the time that patient gets a bed. In Kanawha County, the average wait time is 1 full hour at all 3 CAMC emergency rooms and at Thomas Memorial Hospital. Just 50 miles away, though, on average, you'll wait just 10 minutes for an emergency room bed at St. Mary's Medical Center or Cabell Huntington Hospital. Ambulance and crew are required to stay with the patient until they're in a bed, meaning the longer the wait, the longer first responders are unable to help new patients.
The worst case scenario is that your mother or father or even you get sick and there aren't ambulances to send to you because they're sitting at the hospital waiting for a bed.
That ripple effect spreads far beyond Kanawha County.
2 hours and 58 minutes for a shortness of breath call, an hour and 32 minutes wait time for an altered level of consciousness.
In Lincoln County, there are no emergency rooms. EMS Director Trish Watson moves patients to hospitals in surrounding counties instead. She says going to Huntington and Logan is quick and painless, but sending patients to Charleston puts a strain on her 3 ambulances.
I have been waiting at an ER with a patient who has said, can we just go somewhere else?
And it happens.
Have I ever personally, as a medic, said that they're on red alert or there are trucks sitting there that have been waiting there a couple of hours? Are you sure you wouldn't rather go to Huntington and had patients to agree to do that? Yes, I have.
In Huntington, Cabell County EMS Director Gordon Mary says open channels of communication with the hospitals keeps everything moving smoothly.
When we walk through the door, they're handing us a bed assignment. They have a sheet laying on the counter, and when we come in, we pick it up and we know what bed we're going to the minute we come through the door, and they're waiting for us.
Watson says that urgency makes all the difference.
Huntington is a little quicker if they're not life-threatening, moving them, and Charleston often doesn't do that. They'll just leave them sitting with the ambulance crew.
KCEAA spokesperson Mike Jarrett says longer wait times are partially caused by a lack of resources.
I think staffing in the ERs sometimes is a challenge.
We asked officials with CAMC and Thomas Health Systems for an interview, but both companies released statements. A spokesperson with Thomas Health Systems says Thomas Memorial Hospital is aware of their wait times and are committed to improving their processes. CAMC spokesperson says they too would like to improve their flow of patients, and plans for expansion are in the works at CAMC Memorial Hospital, where last spring, medical help for Katie did come eventually. She was all right, but says the fear of waiting so long is something no one else should ever experience.
People need to understand that this isn't acceptable.
Now, she's just hoping her neighbors won't be forced to wait for a solution.
It needs to be quicker. Something needs to be revamped and changed so there's not such a wait.
Before time runs out on someone else.